Welcome to your colonoscopy. If you're watching this video, that means you've been asked to have this procedure performed. For some of you, this may be the first time. For others, you may have had this test done before. A colonoscopy is a very important part of your colonic health and may help save your life. During the colonoscopy, we insert a small, flexible tube through your colon and look for any abnormalities. We can take off any polyps that we find during that procedure. A polyp is a growth of tissue that could turn into cancer if you leave it alone. We find them, we take them out. Colonoscopy is the best test to find those polyps. It's not a perfect test. There's always a chance that we can miss something, but we do a real good job finding them. It's important for your colonoscopy to have a good clean out. This may mean extending the colon prep if you have a history of constipation. Please tell us before the procedure if you have that problem. If you have hard or difficult to pass stools, or if you go multiple days between bowel movements, you may need an extended clean out. For the colonic clean out, you have to change your diet for 3 to 5 days prior to the procedure. During that time, you want to avoid those healthy foods that are difficult to clean out. These are generally things like seeds and nuts and vegetables. So for 3 to 5 days prior to the procedure, it's important to avoid those foods. Seeds, nuts, vegetables, granola, trail mix. Please no corn. During that time, you can eat other foods which are easily digestible. These are things like proteins such as chicken, fish, eggs, or meat. You could have potato but not the skin. You could have white bread but not whole grain bread. You could have white rice but not whole grain or wild rice. For the colon prep, it's important to speak with our providers about the one that's right for you. For the day before the procedure, you'll have to have only clear liquids. And clear liquids start from the moment you wake up until after the procedure is done. Clear liquids are things like chicken broth, beef broth, jello, but not red jello because it looks like blood. You could have ginger ale, black coffee but no cream. You could have apple juice, water, energy drinks. It's important that you follow these instructions. This will determine how easily we can see polyps growing in your colon that could be precancerous. The day of the procedure, you will wake up, you'll have to have a ride there. You cannot drive yourself and you cannot go to work that day because you will be sedated. When you come to the facility, you'll meet our nurse. They'll bring you back, get you changed, and then they'll put an IV in your arm. The nurse anesthetist will talk to you about sedation and the risks of sedation. Our provider or myself will come by and do some paperwork, say hi, answer any additional questions, and then we'll bring you back to the endoscopy suite, and there you'll be sedated. While you are asleep, we will look throughout your colon for any masses or polyps that are concerning. We will take out any polyps that we find and send them to a lab where they will be evaluated. The results will be back to you within 2 to 3 weeks. During the procedure, we'll also look for any inflammatory process, and we'll take biopsies if needed. Now, there are risks to the procedure, but they're very rare. And those risks include things like bleeding. A small amount of rectal bleeding up to a week later is not a concern. A large amount that doesn't stop would be a concern, and you'd have to come back and we would fix it. There's always a risk of going to surgery, but that's an incredibly rare event. After you wake up from the procedure, the nurse will make sure you're doing okay, give you something to drink, and discuss any of the findings. If there's anything of concern, the doctor will come out to speak with you directly. When you go home that day, it's important just to relax. Don't plan any big events. The day of your colonoscopy is your day off. You should enjoy it. Well, thank you for watching this video. We look forward to seeing you at the procedure. If you have any questions, please call our office. We'll be happy to address them with you. If you'd like to make an office appointment to speak with one of our providers, please do so. We can answer all your questions at that time. Thank you and good luck with your test.